Hello friends, this is Dr. K.D. Tibrewala, practicing physicians at the city of Ahmedabad. Today I'm going to talk about the subject of hypertension on the World Hypertension Day. This is such a common disease. All of you must be aware of it. So many people ask what it is. It is like when the heart beats, it ejects the blood volume into the blood vessels and the pressure is being created, and that pressure against the vessel wall which is being created is known as blood pressure. Normally in a healthy person, the normal blood pressure is 120 systolic and 80 diastolic, and the target of the blood pressure has been advocated to be less than 140 systolic and 90 diastolic. It should be less than 140 systolic and 90 diastolic at any given point of time. And now, what are the people who are at risk, and how we can prevent this hypertension? This is the most important issue today. So we have got certain modifiable and non-modifiable risk factors. Those non-modifiable risk factor can be if the parents are having the blood pressure, the siblings are likely to have 2 to 3 times the blood pressure. The age, like after the age of 40 years, generally you are likely to develop the blood pressure. But these are all non-modifiable risk factors. So which are the modifiable risk factors? So if you've got sedentary lifestyles, you are likely to get it. If you've got excessive alcohol intake, if you are eating a lot of junk foods, if you've got smoking tobacco or you've got tobacco chewing, if you are obese and overweight conditions, you are continuously under the stress conditions. I mean, these are the factors which are generally modifiable and we can take care of them. And if you generally take care of them, probably you can prevent the blood pressure to come, or probably you can prolong it to certain number of years so that it comes not even it does not come at the early stage of the life, it comes a little later at the stage of time. And you will be asking, do we get some symptoms or signs out of blood pressure? Most of the time, generally we don't get any signs and symptoms most of the time. And that is the really troublemaking. This is the real troublesome. The reason being, if you don't get any symptom, you don't go to a doctor, and you continue to have blood pressure and you continue to have problems out of this. And that is the reason why it is called silent killer, because you have got something inside your body which have got target organs being damaged, like heart, like kidney, like brain, like retina in the eyes. So you can get blindness, you can get kidney problem, you can get heart attacks, you can get strokes. So these are the complications out of blood pressure if you don't keep it under control and you don't get symptoms. So after the age of 40, it has been recommended that you should get yourself at least once yearly checked up. And in case you develop symptoms, they are generally in the form of morning headaches, tiredness, exertional breathlessness, little vision changes, etc. And if you get these sort of symptoms, generally you should go and consult your doctor just to get your blood pressure checked up. So can we prevent the blood pressure? Yes, as I told you, you have got modifiable risk factors. As I told you, I mean, try to limit alcohol as much as possible. Avoid tobacco and smoking altogether. Try to manage your stress as much as possible and keep yourself stress-free. Enjoy your regular physical activity in a manner that you are at least you are exercising 5 days a week. Maintain a healthy weight and take your medications properly in case you develop the blood pressure. So in case if you develop the blood pressure, many people ask, can it be cured? As I told you, if you modified your risk factors, probably you can reduce the chances of getting blood pressure or you can prolong it. But once you get the blood pressure, probably you require lifelong medications. It's not something like you're given the blood pressure medicines for a few days and the blood pressure comes back to normal. It will come back to normal as long as you keep the blood pressure medications on. Once you discontinue the medication, the blood pressure will rise again. So it's a lifelong medications. So with this short review on blood pressure, I think it will be useful to you all. Thanks a lot. Thank you.